All right, let's go to our guest line. It's time for our weekly SOS house call, and with our good friend Dr. Todd Battaglia, board-certified, fellowship-trained orthopedic surgeon and head orthopedist for Syracuse University and Lemoyne College athletic teams. Dr. Todd, always great to have you on. How are you today?
I'm doing well. How are you guys doing?
We're doing great. Let's start in the NFL, and really some bad news for Lions fans. David Montgomery thought to be out for the rest of the season with an MCL injury. But then he kind of raised some eyebrows yesterday, saying that things may change when asked if he was out for the rest of the season. So kind of a two-part question, this one. Let's start with the first part. Is there any medical reason why it would be difficult to tell the difference between a sprain and a tear at this point because of these mixed reports out there? Or is it David Montgomery just, trying to have a little fun with the media or have some wishful thinking here?
No, he may not be playing around. A sprain and a tear are sort of all in the same continuum of injury. It's just a degree of how bad it is. So technically in our grading system, a complete tear is actually just a grade 3 sprain. So they're just all kind of various degrees of how bad the tear is, essentially. And MCLs are funny things. A lot of them have the ability to heal themselves, and if they're relatively minor, you can even sort of play through it, assuming you're appropriately braced. But there are some complete tears and some other very specific types that end up needing surgery and take a few months to heal. So devil's really in the details, and it might be possible, you look at an MRI and not everybody agrees on what they see, that they're still arguing a little bit on how bad the tear is and how to handle it. Sometimes MCLs can go down that road.
All right, so even if it's a slight tear, is it, the Super Bowl is 6 weeks away? Is it possible, theoretically possible if there's even a slight tear? Could he be back in 6 weeks?
Yes. Yep. If it were a slight tear, what we'd call a grade 1 or grade 2 sprain, there is possibility he could play in 6 weeks.
If he had to have surgery, is there any chance?
No, that would be a considerably longer recovery time. Really wouldn't work. I mean, it's a Super Bowl, but you still really couldn't risk it after 6 weeks out of a surgery.
All right, Patrick Mahomes, we saw, leave another game with an ankle injury. They've got a 2-game cushion in the AFC. I guess, can you speak to the difficulty of overcoming a high ankle sprain? And, if you were advising him, I know you don't necessarily know his specific case, but how much does rest, even if it was just 1 week, would that considerably help him moving forward?
Yeah, so has that info been made public? I haven't seen the latest. Are they calling it a high sprain on Mahomes?
That's what I've seen, high ankle sprain.
Yeah, so what that means is that it's more than just the ligaments around the inner and outer side of the ankle, that it's actually involving the ligaments that run up the front of the leg a little bit and keep your two shin bones together. Now, some of those require surgery also. The rest of them just tend to mean it's going to be an ankle sprain that takes longer. So, again, with the right treatment and the right taping and, the right pain control and the right sort of hard-headedness, there's certainly a possibility he could play. It really depends on how severe the injury is.
All right, Nick Chubb, another one who is out and looks like he's out for the rest of the season, has a broken foot. He's coming back. 15 months ago he had that gruesome injury. Some question whether or not he would ever play football again. Battled back from that one, and now he's dealing with a broken foot. Can you speak to, I guess, the rehab and recovery from this particular injury? And at 28, we know what happens. There's the steep decline after you get to 30 when you're running back in the NFL. Any concern about whether or not he can get back to where he once was at, 28 years old, 29 years old now?
So I haven't seen anything that says he's headed to surgery. Have you seen any reports on that?
I have not seen any surgery that's been done. No, just that he's got a broken foot.
So that implies to me that he probably broke one of the long bones in the middle of the foot, which do typically heal pretty well and pretty reliably with a cast or a boot for a little while. And obviously he's had other issues. I mean, we know his knee injury last year and whatnot, but at least this specific one, from what I'm hearing, I don't think it's going to be anything that results in sort of permanent disability. I mean, by the time he's back, he'll still be a year older and now 29 playing running back, but I don't think that this foot injury itself is probably going to set him back too much.
All right. And then let's move on to the NBA in regards to Ja Morant, who made some headlines last week, who said that he thought about just quitting dunking altogether when he suffered an injury on an alley-oop attempt. He had a hip subflexation and a pelvic muscle strain on an alley-oop attempt that went awry. He has since started dunking again, but it does raise an interesting question. Do you think that if an athlete like Ja Morant, held himself back from doing that kind of thing in a game, would that enhance his longevity? Would that help reduce his risk of injury moving forward?
I could probably say to a minor degree. I mean, dunking is probably the most, explosive thing you do in terms of jumping, and then there's obviously a lot of impact. These guys get up there and are coming down pretty hard. But, in consideration of everything else they do, stopping dunking may really be not much more than spitting in the ocean in terms of how much overall stress. I have stopped dunking, of course, because I'm 5'9", 10. But that's for a different reason. Maybe he cuts it back in practice a little bit, but I don't know if it's going to make a huge difference and extend his playing career by years if he just stops dunking.
Yeah, we've all stopped dunking. I think that's a movement here on Orange Nation.
Yeah, right.
Dr. Todd, as always, we appreciate the time. Thanks so much for coming on. Enjoy the rest of your week. Happy holidays to you and your family, and I'm sure we'll talk again soon.
I appreciate it. Hopefully we get a win down in San Diego to bring home here. So.
Yes.
Talk to you guys later.
All right, thank you. Dr. Todd joining us here on the show. And
it's funny. You talk about injuries and stuff. It's getting to the point, like, for Washington State, like, if they've got, 20-some-odd guys, you got to start worrying about their players that, don't play every day. And